Good afternoon, everyone. Welcome to our media briefing where we share with you updates on COVID-19 in the Chippewa Valley. Today is Monday, July 27th. It is hard to believe that we are at the end of July already. This month has gone quickly. Thank you for joining us. We appreciate that you are taking time to get good information on what is happening in this area, what the data looks like, and where things are going with this pandemic in this community. There are lots of places to go for information, and we're glad that you're joining us. Today we have Angie Weideman from Chippewa County, the Health Department Director there. She'll be sharing Chippewa County information and data, as well as Luke Feedy, who has joined us most Mondays to talk a little bit about mental health in this pandemic time. I'll share a bit of state data, and then Angie will do a Chippewa update. I'll follow with some Eau Claire information, and then Luke will do the mental health piece, and then we'll be back for question and answer for those of you that have questions. So some state numbers. The total negative counts for COVID-19, the testing is at 823,905, an increase of 6,356 negative tests since yesterday. Total positive cases are now at 49,417, an increase of 590 positive cases of COVID-19 in Wisconsin. Those ever hospitalized are at 4,420, an increase of 26 individuals ever hospitalized. And we are now with one more person that has died of COVID-19 that is a Wisconsin resident. We're now at 893 people that have died. Wisconsin continues over the last week or so to have fairly high case numbers daily. Those have been in upwards of 900 to 1,000 cases. This past day was a bit lower, but we have seen a large number of cases of COVID-19 over the last week or so. The statewide positivity rate as of Sunday was at 9.6%. We do continue to track that data at a state level, and that information is available on the state website. It is a good place to get both state and local data, as well as some regional data that helps inform where we are at with COVID-19 and where things are going. I will now have Angie join us to talk a bit about Chippewa County information. Thanks.
Thank you, Lisa, and thank you to the Eau Claire City County Health Department for having me today. Good afternoon. My name is Angie Weideman. I'm the Public Health Director for Chippewa County Department of Public Health, and I'd like to start with some status updates for Chippewa County. As of today, we have 200 positive cases of COVID-19 in Chippewa County. 41 of our individuals are active cases, and 159 of our cases have been released from isolation. The CDC and state did put out new guidance on who is considered recovered or released from isolation, which now includes a 10-in-1 rule. I used to talk about a 10-in-3 rule. The 10-in-3 meant at least 10 days after symptoms started that an individual was well or symptom-free without a fever reducer for 3 days. That guidance has now changed to 1 day. We also have 7,020 people who have negative test results in Chippewa County. With COVID-19 being a novel virus, there has been an overabundance of information and false information that has arisen in conjunction with the pandemic. We are learning as we go, and we want to share some tips on how disinformation can stop with you. Misinformation is false information, but not created or shared with the intention of causing harm. Malinformation is based on fact, but used out of context to mislead, harm, or manipulate. Disinformation is deliberately created to mislead, harm, or manipulate a person, social group, organization, or country. All three are harmful, especially now. We are asking people to rely on trusted sources. For COVID-19 facts and isolation, quarantine, and travel guidance, rely on state and local health official websites, as well as the CDC and FEMA's rumor control webpage. Think before you share information on social media or through emails. Be sure to check your sources first. Some of the most damaging disinformation spread rapidly via shared post. A few things to consider. Who is it that is sharing the post? What are their motives for sharing that post? Who are they funded by? What kinds of education do they have? Some backgrounds to look for with information are epidemiologists, infection control doctors, and other public health degreed individuals. A pandemic is a special public health emergency, and an MD does not always have a public health background. Look for information published at peer-reviewed academic scholarly articles, especially by people who work in public health or infection control. An epidemiologist is a disease detective. Epidemiologists search for causes of disease, identify people who are at risk, determine how to control or stop the spread or prevent it from happening again. They also have a lot of training in analyzing public health data. Can you find any information about the person or organization who is searching by using a Google search? It's good to kind of check your sources and check the people who are posting just to see if they are reputable sources. We also ask people to be mindful of what you're sharing or posting online, and check your privacy settings. The information you share online can be misunderstood or repurposed via manipulation. Be aware that agents of disinformation often steal identities of real people, profile photos, and other information. Also, please report scams to trusted agencies such as the Federal Trade Commission or the State Consumer Protection Agency or local law enforcement. And watch out for emotionally manipulative content designed to make us angry or sad. Take care when viewing or sharing content that uses sensational terms to divide us in a time of crisis. And this leads me into a second topic that I want to touch on today, which is recognizing the signs of stress and anxiety and taking care of yourself. Strong emotions, even physical reactions, are a natural response to traumatic events and natural disasters like pandemics. There's no right or wrong way to feel or act, and your reactions may change over time. That's why it's important to understand your responses during stressful events so that you can better manage what you're feeling and recognize when you may need support of a mental health or medical health professional. Stress can take many forms, including mood swings and intense feelings, difficulty concentrating or making decisions, irritability, strained relationships, and conflict with family, friends, and coworkers. Also, changes in your normal sleep or eating patterns are a good sign that you might be experiencing some stress. Other people feel things in their body, things like soreness, nausea, headaches, or stomach aches, elevated breathing, heartbeat, or blood pressure. And some people also may have an increased use of alcohol, tobacco, or other drugs when they're stressed. Research shows that people are resilient. With time and support, we're able to recover from adversity. It is okay to ask for help. Remember the challenges you're overcoming in the past, and it's good to remind yourself of your own ability to bounce back. Just remember that recovery is a process. Give yourself some time to adjust now and after the COVID pandemic ends. For more information on resources on coping, visit Resilient Wisconsin's page on Wisconsin's Department of Health Services webpage. And now Lisa will be back to talk more about Eau Claire. Thank you.
Thanks, Angie. I think it is important for all of us to think about how we are supporting one another and supporting ourselves as we are walking through the pandemic and dealing with COVID-19. Reach out to someone today is maybe another piece to tell you all, and find ways to be that support for one another. Eau Claire information. We now are at 13,006 negative tests for COVID-19, an increase of 502 since Friday. Our positive numbers are at 436. We now have an increase of 13 individuals that have tested positive for COVID-19, and 3 individuals in Eau Claire County have died. 364 of the 436 are considered recovered, and that means we are following 72 cases currently for COVID-19 and all of their many contacts, hundreds of contacts as well. Again, making sure that people that do have COVID-19 are staying home and not infecting others, and that their close contacts are also staying home so that we have a small spread of disease whenever we have a case. As we typically report on Mondays, we share with you jail-related data. We have 40 individuals tested for COVID-19 in the jail. We continue to have 7 individuals that have tested since the start as positives, with 1 person that is currently a active positive. We also continue to track all of our testing and case data. That data is available on our website, covid19eauclair.org. Not only can you find the updates daily of the counts, but it's broken down in a bit more detail there. Cumulative case numbers are slowly increasing over time. That is a good thing. Rather than having the 15 to 20 cases per day that we were reporting to you a couple of weeks ago, we now have leveled off more slowly in the number of cases per day. That has been our goal. That's why we are doing the work together to slow the spread. And we're hopeful that we continue to have good testing numbers and that we have lower numbers of people that are found to be COVID positive on a daily basis. We aren't going to stop the spread. We are at that stage of slowing the spread, and our case numbers per day really make a difference in that. So again, we continue to have that goal. We are counting on people to really lean in and do things differently for now so that we can keep the spread of the disease more slow. And it seems to be moving in that direction at the moment. So I will now have Luke come up, Luke Feedy from the Eau Claire County Behavioral Health area, and he's going to share a little mental health update with us.
Thank you, Liska. Thank you, Angie, for the work you guys are doing. So 2020, it's been a time of uncertainty, confusion, and at times frustration. It has also shown us that as a community, we have an uncanny ability to adapt, think on our feet, and support one another. These unprecedented times have reminded us that there are things that are outside of our control. While we cannot control what will happen throughout the rest of this year and into 2021, we can choose to be planful and identify what we may need. There's an old adage that may be truer today than ever before. Hope for the best, plan for the worst. Having a plan gives us some semblance of direction and predictability. These are things that we could all use a bit more of in today's world. A couple of examples of plans that might be helpful may include a plan for schooling or teaching from home if schools close again in an effort to combat COVID-19. If possible, it may be helpful to identify a space in your home where children can conduct their daily school-related activities. Identify supports that can help you manage your workday as well as help teach your children. It may also be helpful to create a schedule of sorts that allows for you and your children to know what a day of schooling at home will look like. Another plan that might be helpful is one that identifies how you will handle things if a family member falls ill with COVID-19. This may include identifying a space in the home where the family member can recover in quarantine. It may also be helpful to identify trusting adults that can help with childcare if the person diagnosed is one of the primary parents in the household. Many families have plans for things like fires in the home or inclement weather, and these plans are simple and feasible. I would encourage you to create these plans in those same ways. Something that's easy to follow, predictable, and something that you know is possible. We cannot predict what will happen in the future, but we can respond in a prepared way. There are several resources that can help with making a plan. The CDC has a number of different templates that any family can use to help make a family plan, from anything from fire to inclement weather to dealing with COVID-19. Again, having a plan gives us that little bit of predictability and that little bit of what we need right now. So thanks again, and take care of yourselves.
Thank you, Luke. It's certainly better to plan ahead than if any of us have to deal with a situation related to COVID that takes some extra effort. We have at least thought about it, and that's a helpful starting point for every one of us. Again, we are wanting you to get good information like Angie talked about. Please check our websites out. Social media for the health departments, both Chippewa and Eau Claire, are also a place to go. In Eau Claire, the COVID-19 eauclaire.org website, and our call center number, if you can't get the information you need at that website, that number is 715-831-7425. We'll be back on Wednesday to share more information with the recent data that is done via streaming on Facebook Live. And the three of us are available to answer any questions that you may have. Yeah.
We were wondering regarding kids with masks in schools. It sounds like City of Altoona, they're probably not going to be requiring them, and the school district of Eau Claire is considering it. Mm-hmm. Just wondering your thoughts on it. The DHS says that kids shouldn't need to wear masks in school, so just kind of wondering your opinion on
Sure. That. So the question is related to the use of masks in schools and really what is the best practice. Certainly across our community, we are talking regularly about people wearing cloth face coverings or face masks, really when they're out in public. That's the best practice. That what will make a difference. There's strong data available about that. In a school setting, certainly in those situations where students, faculty, or staff is not able to regularly assure that they are 6 feet apart, we're strongly encouraging schools to find ways to distance as the first strategy, and when and if that is not possible, to find other ways to decrease the risk of transmission, including the opportunity to wear cloth face coverings in situations where that's possible. Certainly every school is trying to find ways to keep faculty, staff, and students as safe as possible given COVID-19, and the use of cloth face masks is one of those strategies. Different ways to move forward are certainly appropriate depending on an individual situation of a school. We are working closely with all the schools in Eau Claire County, as are all health departments in this part of the state, to really make sure that we're supporting those best practices. Any other questions?
13 cases, that's since Friday, correct?
So the question was 15 cases. There are 15 additional cases in Eau Claire County since Friday. That is correct. 15 cases. Thank you for that clarification.
And you mentioned, because in recent weeks it was higher than that, but now it's slowing a little bit. Do you have any thoughts on why it might be slowing?
So the question is related to, it appears that our case increases. We continue to have cases every day, but the rapidly increasing numbers seem to be slowing a bit. Again, too early to say whether this is an ongoing trend, but we certainly are encouraged that the last few days our case number increases have been a bit lower. They've been in the single digits rather than the double digits. We are hopeful that people are increasing their strategies around making sure that they are staying safer and making sure that there are ways to really keep that 6 foot distance and keep circles small. But we know that some people are choosing not to do that, and we want to make sure that that is continuing to be a message that is part of our public health order and part of the work we need to continue to do as a community. Just to clarify, again, you asked the specific question about the number of increased cases in Eau Claire County. So in Eau Claire, our increases, and I will just say that again so everybody has the correct information, we have an increase of 13 cases since Friday. We are now at 436 positive cases for COVID-19, 13 case increase. Yes?
I guess this question is for Angie. Wondering if you have any update with the testing that was done at the fairgrounds, if any of those numbers are back, and when we can maybe expect those results.
Great question. So the question is about the testing that was done at Northern Wisconsin State Fair last Monday, the 20th, and we are just getting final results in. So many of the results have come in, but we don't have our comprehensive results yet. We should very shortly and are already looking at that data to see, what percentage of individuals were asymptomatic, which percentage were symptomatic, and then kind of what is the percent positive based on that event. So we should have information in a day or two. Thanks.
Are there any additional questions today? Yes.
When you talk about the jail numbers, are those numbers counted towards the County of Eau Claire, or is it, I guess, where, if they're not from the area but moved into the jail, or they're from another area, committed a crime in Eau Claire and arrested in Eau Claire? Mm-hmm. How are those numbers, I guess, sifted through?
Sure. So the question is related to the numbers that we report related to the jail in Eau Claire, and what county of resident do they land. Typically, in a jail setting, we ask about what the permanent address is, whether it's a staff person or somebody that has come into the jail. And whatever that person's address is the one that is counted. Of the count that we have, I'd have to verify of the 7 tests if they were all landed in the Eau Claire count, but I can certainly do that. Any additional questions? All right, thank you for joining us today. We'll be back on Wednesday on Facebook Live, and we look forward to sharing more information with all of you then.